Hello everyone, I am urologist Omar Erdamakaya. The subject I will talk about today is about patients who use premature ejaculation spray and then develop permanent or long-term erectile dysfunction. 10 years ago, I was really surprised when I heard this complaint from a patient for the first time. Because premature ejaculation spray is one of the ordinary treatments we normally give for premature ejaculation. The premature ejaculation spray, which contains about 10% lidocaine, is applied 30 minutes before the patient has intercourse, waits half an hour and cleans it. Then he has intercourse. It is a treatment method with a very high patient satisfaction rate. Some of the patients say that they used a spray for premature ejaculation on the night of their first intercourse. Or they say that they used it years ago and then developed erectile dysfunction. We have become familiar with these now. This happens individually. Because it reduces the pleasure of the person, his erection may deteriorate. Or a patient with already weak erection ability may develop erectile dysfunction. Some patients can directly tell the day they experienced erectile dysfunction. They say that they used premature ejaculation spray on the night of their first intercourse and developed erectile dysfunction. When we listen to these patients in detail before and after the event, we learn that they have a weak erectile capacity. We learn that they have fears about sexuality and that they did not have an active sexual life before. Such a patient can sometimes wait for a triggering event. For example, they say that they used a pill and developed erectile dysfunction and it never got better. In fact, the cause of this triggering event is the patient's own stress. The patient reaches the threshold of stress. He is on the edge of a cliff and waiting for someone to push him. So he is looking for an excuse to develop erectile dysfunction. There are two systems in our body, the adrenergic and autonomic systems, which ensure our survival and sustenance. The adrenergic system is a system that increases in case of stress and anxiety. There is also the autonomic system in our body. It helps our body to work in balance, to stay in balance, to survive. For example, breathing, swallowing, the functioning of the gastrointestinal system, pooping or sexuality. The body erects the penis on its own when there is an external stimulus. In other words, it is a system that provides a connection between the penis and the brain, the autonomic system. How can excessive stimulation of the adrenergic system happen? For example, we have terrorism veterans or police officers. They are under the influence of many events. Their adrenergic system is overstimulated and their panic and anxiety are high. They wake up suddenly at night. They get angry quickly. They can be quick to react to events. They constantly think of the events they have experienced before. The person was completely normal before these events. Here, when the patient has unsuccessful sexual intercourse several times, the adrenergic system increases excessively. As a result, the person's autonomic system starts to be suppressed and the connection between the penis and the brain gradually begins to break. One of the most common treatments I apply in these patients is penile Botox treatment, drug treatment. Of course, we eliminate other conditions first. If there is penile venous leakage, we intervene. But in such patients, the increased adrenergic system may cause the smooth muscles of the penis not to relax and not to fill with blood. When intervene acutely in such patients by injecting Botox into the penis, we can get an effective response. Of course, our aim is to give the patient a strong erection stimulus and to enable the patient to have successful sexual intercourse immediately. The patient cannot get over this trauma at once. We should not underestimate such performance anxiety. No human being wants to be in a place where they fail. It always brings pain, sadness, and grief to the patient. But he wants to stay more in places where he is successful. And he is naturally more motivated. This is actually what we do. A rapid intervention in the smooth muscle cells of a person. With an increased adrenergic system and a suppressed autonomic system. As a result of this, it is possible to ensure successful sexual relations, successful sexual harmony, partner harmony in the patient. Of course, if the partner is also a partner in the treatment, we really get more successful results. If there is varicocele, varicocelectomy; if there is penile venous leakage treatment. These are all organic problems. These are problems that can be treated, friends. It is necessary to approach both organically and psychologically. Even if we treat them organically, we have to treat them psychologically as well. Finally, I would like to come to a point. A person can suddenly have erectile dysfunction. I have seen this many times. But if the person does not reach treatment, does not seek treatment, does not do something, this problem grows in this vicious cycle, and becomes irresolvable. If you are experiencing such a situation, it is useful to get support from a health professional as soon as possible. In terms of finding the right way, this is the case with erectile dysfunction that occurs after premature ejaculation spray. Thank you for listening. Best regards.